Healing Wings Dental based in Arlington, Texas. And what we do is we help people regain their wings by allowing them to maintain and regain their oral health. So today, what I'd like to speak to you is what to expect when you come to the dentist. There are many people who don't really know what to expect, but to jump on, I want to let you know that you must understand that coming to a dental practice is the same as going to a medical office. And that being said, is that it has to do with your health. So I'm going to give you a key point that happen when you come to the dentist. First of all, when you come, um, you will be asked to fill out your medical history and also your dental history. There are many diseases or many medications that someone may be taking that may lead us to treat you a certain way or not be able to treat you a certain way, or have to refer to your medical doctor to ensure that you are safe with all the procedures that we are doing. The reason why I want to emphasize on that is because there are many people who don't quite understand why they always have to fill out a form that talks about their medical history or even the dental history. And they find it to be unnecessary. They don't really relay all the information about the medications that they're taking or the conditions that they have. And it may cause us to find or to reach some difficulties or some problems when some things are not disclosed. There are many people who complain they don't want to fill out these forms, and so it's very important for us to collect all this information. So that's the first thing that you'll be doing. Now, once you are done with giving us all your information, you will be now taken, and we have to take your vitals. Again, most people are compliant, but there are some people who do not want to comply. They don't understand why we have to take your blood pressure. They don't understand why we have to take your weight. And some people are even so adamant. They say, I don't want you to weigh me today, or I'm coming here and this is the first office where I'm asked to take the blood pressure. I don't want to do that. I want to let you know that without those data, without the vitals, it's going to be very difficult for us to treat you appropriately. Your weight is going to allow us to know how much, for example, how much anesthesia we are able to use on you. So if you, for example, come with one of your child and he has so much problems that we need to treat, then there is a threshold that we can use based on the weight. So that's where the weight comes in to be handy. So it's not that we just want to be nosy, but those are necessary information. And even with the blood pressure, if your blood pressure is normal and you have issues that need to be treated, you have cavities, or you need something to be done, we can do it the same day because your blood pressure is good. But if your blood pressure is too high or too low, we will not be able to treat you that day, because we can end up causing you some harm with you having a high blood pressure. So those are the reasons why it's important for us to get those kind of information, to get the vitals. It's extremely important, very necessary. In fact, we cannot treat you without knowing what your blood pressure is, without knowing what your weight is. So just, it's important. I just wanted to let you know that so that you can understand and don't feel like we are requiring you to provide us with information that is not needed. So once that is done, you will have to now go and obtain radiographs. And we have found most people are compliant. As I say, we always have patients who are very compliant. However, you always end up having this one patient that is not, and that is fighting for whatever reason. There are people who don't want to have their x-rays taken. And so we cannot really, there are some things that we can see with our naked eyes, but there are some things that we cannot see. We do not have, unfortunately, x-ray vision. And so we need to have x-rays taken, radiographs taken, so that we can see problems that lie beyond what we can see with our naked eyes. To give you an example, there are some type of infection that are starting that we can see on the radiograph. We can see that there's maybe a radiolucency at the end of your root, and now we know that your tooth has been infected. We may or may not see that on our naked eye, because it's not all infection does not necessarily come because there's a big cavity that is there on the tooth. You could have experienced trauma, which is something that happened to me when a long time ago I was unloading my groceries, and unfortunately I hit my tooth on my car, and it was months later that I started developing an infection and eventually got treated. So there are some things that we are not able to deduct or to know or to diagnose without having radiograph. Another thing is, for instance, cavities between your teeth. Sometimes they're not huge, but on the x-ray we can see them, but with our naked eyes, it's not so big that we can actually detect them. So we do need radiograph. We cannot diagnose what we cannot see. So that's the reason why we need radiographs. And also, for you to be at peace, we want you to understand that the technology has so evolved that really the x-rays that we are using to determine, the situations or the conditions that you have, they're not very harmful. We'll say that the fact that you use using your cell phone or using even being under the sun can create more damage than the x-rays that we are using. So just rest at peace. The x-ray that we are using will not really be detrimental to your health. After having taken the x-ray, now the dentist is going to come to the room and they're going to analyze your x-rays and also to do a clinical exam, because there are some things that can be seen on the x-rays yet cannot be, but some other things have and cannot be seen on the x-rays, and there's some other things that have to be detected clinically. So we do a clinical exam, and after having that, now the dentist will let you know all the diagnosis that has been found, the course of action that needs to be done. A treatment plan is shared with you by one of the members of the team, and now you're going to be able to know what needs to be done. And depending on the office, treatment may or may not be done the same day. In our office, for example, at Healing Wings, and depending on what you need, most of the time we are able to provide you with same day services. So now it just depends on, how busy the office is, how many patients are there, or just the policy of that particular office. So then, that's the end of the treatment plan being explained to you, and of course you're going to have to make your payment, and on your way you are. I wanted also to let you know that if you have insurance, we prefer that you provide us with the insurance information before you even come to your appointment. Why do I say that? Because some people, when they call to make an appointment, they may say, I don't have my card with me, but I'll bring it to you when I come in. Well, that's very good. But the problem with that is that it takes a long time sometimes to be able to reach someone at the insurance that you have, to be able to reach someone from the customer service who is knowledgeable enough to let you know everything that you will be covered for, the percentages, and all of this. I've seen cases with my employees where they are on the phone for even sometimes more than an hour trying to obtain information from the insurance insurance company. And sometimes they may be talking to someone and the phone call may drop. And so they have to call again, and they have to call and call again. So if you provide us with the information ahead of time, we are able to verify the insurance before you come, and we can tell you exactly what your cost will be and what the insurance will be paying or covering. So those are things I wanted to discuss with you today. So again, we are Healing Wings Dental. We are located at 4101 West Green Oaks Boulevard, suite number 317 in Arlington, Texas. We can be reached also to request an appointment or to make an appointment at 972-213-0202. And also you can find us on our website, healingwingsdental.com, where you can request an appointment. If you don't have a dentist, we are here to help you. If you like the information that we are giving you, we would like to help you, and we are available to do so. So if you find this information important to you or pertinent, please don't hesitate to share it with your friends and family, so that they can also be educated on the subject. And don't forget to like also. So that being said, have a great day. May your day be blessed, and do everything you can to keep a day positive for you, because it is within your reach. Have a good day. Bye-bye.